It's time for your healthy dose of information brought to you by Hannibal Regional Hospital, Hannibal Regional Medical Group. And joining us this morning is the Director of Outreach Services, Aaron Zook. Good morning, Aaron.
Good morning, Greg. How are you?
Great.
Good.
Thanks for coming to join us
Thanks
this
for
morning.
having me.
We were talking about foot pain this morning, and it's something that a lot of people, wouldn't you think most people to some extent deal with a little bit of foot pain?
You know, I think we all feel some discomfort in our feet, some pain in our feet, and we just think, hey, it's just part of getting old. I had a rough day yesterday. There's a reason my feet hurt. And then we kind of ignore it. And, when we think about it, our feet are really important to what we do, and we just don't give them a lot of attention like we should sometimes.
So we'll do that right now.
Yeah, that'd be a good thing.
Attention on feet. The foot is a complex structure, really an amazing thing. I mean, because it's got so much going on there.
Yeah, it is. It is truly amazing. It is a marvel of... to me, it's a marvel of how your body's put together and how it works. Without thinking about it, I mean, we've got 5 toes in there. You think there's not many bones, but really when you look at it, there's about 26 different bones in your foot. There's about 33 joints, 107 ligaments. So in that little thing touching the ground, there's a lot of structures that have to work together, have to work in concert to make sure we stay upright and we can move. So it's truly a complex piece of engineering in our body, and it's one of those things where in medicine we talk about specialties and specialization. Podiatry is one of those areas that's focused just on the foot, and part of the reason why is it is such a complex piece of equipment in our body.
That's why you have podiatrists who just deal directly with issues of the foot.
That's absolutely right, and when they talk about issues of the foot, we could talk about so many different things. Pressure sores, trouble with toenails, foot pain, broken bones. There's just a number of things that can go wrong with your feet.
And those things can be caused by many things. I mean, it just your own structure, the way that you walk,
Sure.
the hard surfaces that we're on, the shoes that you wear, all the different factors.
Yeah, you hit on a lot of good points there. We all know if we look at our shoes, they all have a tendency to wear one way or the other, and everybody wears a little bit differently on their shoes. So I know for me, I can look at the heel of my shoe and I notice one side of them starting to wear off quite quickly. That's due to the way that I walk. And so whenever you start walking on that unstable surface because your shoe's worn out, I mean, your foot has to adapt. And you think about it, every time your foot strikes the ground during the day, it's probably thousands of foot strikes during the day. It's just like a constant pounding on those feet. So if we're not protecting our feet the way we should, not providing the support we need, we're going to end up with some injuries.
Yeah, especially if you're not maybe putting forth all the effort you should to find the right shoe for you.
Yeah, shoe gear choice is very important. And a lot of times you can talk to some of the sales folks at your shoe stores and ask some of those questions. The other thing is just to have some general knowledge yourself. We talk about things like flat feet, high arches, turning your foot in, turning your foot out. Knowing what kind of foot type you have is very important to choosing the shoe gear that you want. Some folks are prone to ankle sprains, things like that. So you need a shoe that has more stability. Some people like to run outside, cross-train, things like that. So a shoe that's built towards cross-training and exercising is important. And your podiatrist is more than happy to give you some pointers about those kind of things.
I think one of the best ways that I've found to decide whether a person needs a supportive arch, a supportive shoe, is to put your foot in the pool and then step on the concrete, and you're going to see the imprint of your foot. If you don't see anything in the middle, it means you have a very high arch.
That's
if
right.
you see the imprint of your entire foot,
whole foot, yeah,
you don't have much of an arch at all.
That's right. You need to get some support on that foot. That's for sure. And even with the high arch, you still need support for the high arch because a shoe is made for a normal sized arch. So if you have a high arch, your high arch isn't getting any support from a regular shoe. So it's very important, like you said, to do some self-assessment like that, see what kind of an arch type you have, and then go buy the shoe that's specific to that. And part of this whole discussion as we're talking, I'm thinking, not everybody exercises, not everybody wears tennis shoes, but we all wear some kind of shoe. So for all those folks that are working out in the industrial arenas, farmers, things like that, it's important to choose the right kind of work boot as well that'll fit your foot. I mean, there are orthotics, things that you can get to insert in that work boot to help provide support to that foot. So don't think it's just picking the right tennis shoe or the right dress shoe. Work boots are very important as well to pick the right kind of support in those.
Yeah, that's a very good point. A lot of those are just flat.
Yeah, they are.
You need some kind of support,
That's
and
right.
you might have to add something like an insert
Absolutely.
to that.
Absolutely.
When you talk about foot pain, if you're somebody that stands all day, and if you're somebody that exercises a lot, you could really deal with that.
You really could. And, we think about how many times your foot strikes the ground throughout the day. And you think about walking on concrete or asphalt. Those surfaces don't really give, so it's a hard surface. So if you think about it, it's truly just a jolt every time to all those little joints in your feet. So if that shoe or that shoe gear is not providing a little bit of cushion to your foot, I mean, you're just magnifying the symptoms of the wear and tear on your feet.
Yeah, absolutely. So you really need to be aware of that. And also, you may be impacted by certain medical conditions, too.
That's very true. One of the classic things we talk about a lot is diabetics and getting their feet checked. But diabetics aren't the only folks that need to get their feet checked. As we get older, we all know that maybe our feet get a little more colder than they used to. Maybe we don't feel as well in our feet. So taking time to actually look at your feet every day, inspect them, make sure that there's no wear and tear, red spots, calluses, things like that forming that you need to be aware of. And the other thing to think about is, I'm very guilty of this. When I get out of the shower in the morning, I just wipe my feet off and don't take the time to sometimes dry in between my toes. And during this time of the year when it's hot and humid outside, we all need to pay attention to make sure that our feet are good and dry and in good health, because you don't want any fungus or anything like that growing in between those toes.
Yeah, especially if you're working out at the gym and things like that.
Yeah, absolutely,
too.
absolutely.
That can definitely go around. Medical conditions that cause foot pain can be arthritis, obesity. If you're overweight, you may need to lose a little weight to help your feet feel better. And also something you and I have absolutely no experience with, pregnancy. I mean, that's a big factor.
It is, and I'm glad we don't have any experience personally with pregnancy. But we think about it. Those pregnant ladies, a lot of them experience the swelling in their feet. And the other thing, as women become pregnant, those ligaments become very lax throughout their body. So you think about the hundreds of ligaments that are in your feet, and as they become lax, couple that with the extreme amount of swelling some ladies experience in their lower legs, that's primed for some foot troubles.
Mm-hmm. Yeah, and God bless them. They're going through enough already. They
Bless
don't
their
need
hearts.
that
That's
too.
right.
Yeah.
That's right.
What about medications? Can medications cause medical conditions that cause foot pain?
Certain medications can, and it's like anything. Every medication is going to have a little bit of a side effect. So be it a medication causing some trouble with balance, equilibrium, be it a medication causing some trouble with feeling, things like that. Like I said, all those medications are going to have some sort of side effect. So, it goes back to our opening statement. We don't just want to attribute foot pain to doing increase of activity or things like that. It's truly something not to ignore. And it's important to go talk to a professional that knows all those things that may impact your foot pain and have that discussion to see, is there something that is going on that I have no control of that's causing my foot pain, and what can I do to adapt?
Yeah, it's a good point. Are women or men at higher risk for foot pain?
It truly is kind of split right down the middle. It depends a lot on body type. It depends on medical history. It depends on activity level, those kind of things. So as far as saying men, women, one more than the other, there's really no clear-cut way. Now, we will acknowledge that some of our ladies out there like to wear high-heeled shoes, things like that, which are hard on the feet. But as Dr. Klein says very often, he doesn't want to tell ladies you can't wear high-heeled shoes. There are slim-down orthotics, things like that can be put in those shoes to help cope with some of the mechanical challenges of a high-heeled shoe.
Very good point. So how do we prevent foot pain?
Well, number one is to recognize it's happening and then go talk to somebody that knows something about it, which is why during the month of June, we're hosting screenings for foot pain throughout our various locations. What we wanted to do is just provide an opportunity for folks that think they may have some sort of foot issue to come in and have a quick 5-10 minute consultation with Dr. Klein and talk about some of these things and ask some questions. And between Dr. Klein and the patient, come up with some plans that maybe there is a need for follow-up, or maybe it's as simple as just buying a different kind of shoe. So during the month of June, we're hosting those in all of our locations. And if folks would like to make an appointment for that, we ask that they call our main office building at 573 629-3500 and just ask to be signed up for one of the foot pain screenings, and they'll give you a date and time and location that's closest to you. And we encourage you to come in and have that discussion with Dr. Klein.
And this is Dr. Ed Klein, who's a podiatrist at Hannibal Medical Group.
Hannibal Regional Medical Group,
and
yes.
He right now is on location in Bowling Green, Missouri.
That's right. He's not here this morning because he's in Bowling Green conducting one of these screenings this morning, and he'll be going to Louisiana, Missouri later on this afternoon. He's already been in Canton, and we have dates left in Hannibal, Shelbina, and Monroe City, and then we also have a waiting list, actually, so we're getting ready to launch our next round of dates as well. So this is one of those things. I believe we've had about 25 folks show up to come in and ask these questions, and we encourage more to come in and ask, and we're here to help.
All right. It's the Pain in the Foot Tour with Dr. Ed Klein.
I'm glad it's just a pain in the foot.
No doubt. The key to a lot of this, I really think, is getting the right shoes and making sure that you've got the right support. It makes a huge difference.
It does.
I hear people talk about, they're on their feet all the day at work, and they get the right shoes. It can totally help that, especially if you exercise a lot and all that. Just take the time to do that. If you want to find the most fashionable, best-looking shoes, that's great, but take the time to get the right support at the same time, too.
That's absolutely right. You said it.
Yeah, take your time doing it. And you may have to spend a little extra to do that, too. And I know that's tough for people, but man, spending the extra money to get the right shoes makes all the difference.
Well, that, and we think about at the end of the day, when you don't have the right shoe and your feet hurt and your legs ache, all you want to do is go home and just sit and do nothing. The day has been miserable because your feet hurt.
Right.
So getting that right kind of shoe, spending a little bit extra to not hurt is very well worth it.
Yeah, definitely. It's going to help you be a lot more productive, too.
Absolutely.
So these foot screenings, again, taking place around the tri-states, and you can call Hannibal Regional Healthcare System for more. That was 573-629-3500, right?
Yes, sir. That was right.
Very good. All right. It's Aaron Zook, who's the Director of Outreach Services. A pain in the foot here. Your healthy dose of information from Hannibal Regional Medical Group and Hannibal Regional Hospital. You can check them out online at hrhonline.org.